Everyone, it's Cole again, and welcome back to Cole's Pain Relief Reviews. Today we're going to be talking about a less known pain relief product. It's called TENS Therapy. This is how I'm planning on making these videos, scheduling them. We're going to do 2 videos a week, try to. One video that is something that people know about and maybe want to learn a little bit more. And the second one's going to be something that people don't know so much about and that maybe can be a new thing that you could add. So today we're doing TENS therapy, which is transcutaneous, which means through the skin, electrical nerve stimulation. It's called TENS for short. And it's a pain relief practice where low voltage electrical stimulation is used to block pain. So there's 3 mechanisms on how TENS blocks pain. The TENS therapy stimulates nerves in the pain site, blocking pain signals. This is called the gate theory of pain. Here's a little aside about it. The original gate theory proposed that competing sensation could activate gates in the spinal cord that could block other signals. This theory has become mostly outdated due to the mechanism, but it's kept around as a useful analogy. More modern explanation of competing stimuli with pain is that the non-painful stimulus competes with the pain stimulants in the brain. So it's taking up more brain attention rather than actually blocking the nerve channels. But they still keep the gate theory for that explanation, but not really so much for the mechanism. This makes it a perception change rather than a signal conduction as proposed in the original theory. This is why distracting yourself can result in decreased perception of pain. I'm sure everyone has experienced when you're doing absolutely nothing and you have really, really severe pain because it's all you can focus on. But when you're doing other things, it can really help get rid of that perception. The gate theory of pain cannot fully explain the effectiveness of TENS therapy because the majority of people who use TENS have relief after the stimulus has stopped. The second mechanism which TENS blocks pain is that it increases endorphins and other inhibitory neurotransmitters in the body. Essentially, in summary, TENS activates inhibitory mechanisms such as endorphins, GABA, and serotonin. These mechanisms reduce nerve transduction of pain signals and perception in the brain. Endorphins activate opioid receptors, which give reduction of pain and euphoria. GABA increases the electrical stimulation required for neuronal firing and decreases the amount of pain signals sent to the brain. Serotonin creates feelings of relaxation, contentment, and sleepiness. The third way TENS is thought to stop pain is modulation of the central nervous system. TENS therapy has been found to reduce the excitatory neurotransmitters glutamate and substance P in the spinal cord. Substance P is primarily an excitatory signal in response to stressful, painful, and noxious stimuli. Glutamate is the body's main excitatory neurotransmitter. Glutamate signals for all sorts of good things such as learning and memory, but it also signals for pain, so a reduction after TENS is actually beneficial. TENS both encourages signals that decrease pain and decreases the presence of signals that increase pain. Now that we have some understanding of the function, let's talk about the pros and cons. So the pros is that you have immediate relief. You don't have to wait for medication to kick in and get digested. You've got relief in a different form that can help after you've taken meds because you can take your medication and use TENS. You can't overdose on it. And it's pretty affordable after your first upfront payment. It's about $10 for the pads and they last 6 months, but they can probably last you longer if you're willing to hold them in place. I think they just lose their stickiness after 6 months. And it can treat many different types of pain. Some of the cons are there's some discomfort because the studies show that you need to use the most intense setting without pain to see results. So you're going to experience some level of discomfort if it's going to be effective. Pads don't stick very well in places with hair. It's kind of annoying for me, especially with my knees. I have to hold it there. And there's a high upfront cost, around $50 or more for some of the bigger brands. But afterwards it's pretty cheap because the pads are cheap. And it's less effective for people taking opioids because the endorphins released are not as effective because you get those from the opioids. A big warning is never to take this without talking to your doctor if you have a heart condition or you use electrical hardware. Definitely don't use any of that unless you talk to your doctor. So my personal experience in my review. So this is unsponsored, but I've got an Omron brand over-the-counter TENS therapy machine. It cost me around $50, and it's got 9 different settings: tap, knead, rub, arm, lower back, leg, foot, joint, and shoulder are the 9 settings. And it has a lot of options. I primarily use it in knead mode because the knead sends shock waves that increase and decrease with intensity, which I find more soothing than the other settings. It also has 15 levels of intensity. I use it on 15 on my knees because my hair blocks a lot of the electrical connection. I use it around 11 to 13 on my neck and upper back. I find it useful for my neck and back as medication fails to move most of the pain there, and it provides some relief for a few hours after I use it. I'd rate TENS a 9 out of 10. I think that anyone who has chronic muscular joint pain should have it in their arsenal for relief. I'd rate the Omron brand an 8 out of 10. The many settings and portability are nice. It would get a higher score from me if the safety setting wasn't as strong. If the system senses a poor connection, it turns off, which means I need to press it down directly on my knees because the glue isn't great for places with a lot of hair. I think it's a good value for its price point and a good product. So yeah, thank you for tuning in, and I hope this was educational and you're now considering a new product in your pain relief arsenal. Please remember to consult your doctor before adding new medications, including over-the-counters, to your regimen. I hope you have a pain-free day. And for anyone wanting to read more, the sources I used are in the description. Thank you.